Welcome to the Back on Track Achieving Healthy Weight Loss podcast. I'm your host, Dr. Alicia Shelly. So one of my viewers actually sent me a question about what is bariatric surgery? And so I realized I could talk about it, but we really need to hear what bariatric surgery is from the actual surgeon that does bariatric surgery. And so I am so excited to be talking to Dr. Kalina Tuggle McDaniel, who is a health expert and enthusiast, body positivity, self-love advocate, and a medical director for a bariatric surgery program in Atlanta, Georgia. She is passionate. She wants to empower the Black community through health awareness and education. Thank you so very much for joining us today, Dr. Kalina.
I am honored. This is so awesome what you do and spreading the word about health in general. I think weight maintenance and management is something that the majority of us go through. So I love that you have this platform to educate people.
Well, thank you so much. This has been my true passion.
I know, and it shows. It's amazing.
Well, before we get started, would you mind maybe just telling us a little bit more about yourself?
Sure. So I've been a bariatric surgeon now for about 13 years. Been in Atlanta the whole time, and I think I went into bariatric surgery because it was one of the few surgical subspecialties where you could change somebody's life, almost like giving them like a second birthday or like like a second lease on life without the morbidity of like an oncologist or a cancer surgeon. So I like the fact that a lot of people can kind of re-own their life. They kind of take their life back and they get more freedom, and you just see just a happiness of people kind of take charge and are not kind of held to the shackles that obesity and excess weight can have on them from the comorbidities and the medications, the self-esteem. And I love that. I love seeing people being able to own their life exactly how they want to.
Yeah, you're so right. With that bariatric surgery, nothing is limited. Like you are able to take back that life.
Well, the only limit is the patient. You can take it as far as you want, or you can do nothing with it.
Oh, awesome. That is wonderful. Exactly. The only limit is you. That is you. Well, tell us, for those who may not be aware, what exactly is bariatric surgery?
So bariatric surgery, contrary to I think most people's perception, when I say weight loss surgery, they think cosmetic off the rip. So I always get asked, do you do tummy tucks and lipo? And I don't. That's plastic surgery. But bariatric or metabolic surgery is really about losing weight. But the real gem of it is curing or improving your diabetes, your high blood pressure, your sleep apnea, your high cholesterol, which decreases your risk factors for premature death, being able to maximize your quality of life. So you don't need the cane, the wheelchair, the oxygen. So it's really about understanding that the weight loss is an awesome side effect, but it's about improving your quality of life and your overall health picture. So that's the difference. I work on the inside. Cosmetic is on the outside.
I like that because people kind of get that really confused
all the time.
Okay, actually, liposuction. You're like, nope, that's not it. That's not it.
I don't do that.
Yeah, because we also have fat that's around the organ that don't go away with liposuction. So
and that's the actually more deadly fat. That's the fat that people need to pay more attention to, because I could say at least once a week I get somebody who is interested in bariatric surgery who already had the tummy tuck and the BBL and this sucked and this pulled together, and they're back where they started, just tighter.
It's tighter. Okay. Well, let's chat a little bit about what are the most 4 common surgeries that you perform or that's performed in bariatric surgery.
Okay. So we will start with the least aggressive. So the band, which is probably the least performed now, but when I did my training back in 2010, it was the most common next to gastric bypass. But essentially, your anatomy is unchanged, and there's a little plastic ring that we put around the top of your stomach that we're able to inflate. So we can make it looser, we can make it tighter. The goal is to make it tight enough where you have early satiety or you feel full relatively quickly and you don't continue eating without making it so tight that you're having a lot of reflux or difficulty swallowing. It is a tricky tool to manage because it can move, it can slip, it can erode. You have to go back and forth with adjustments. Where's the sweet spot? And it actually doesn't have enough change anatomically where people are able to keep the weight off as much as some of the other procedures. So I take out more bands than I put in at this point.
And is there anybody who's like a candidate for this, or can it be just anybody who has a certain BMI that can get this particular procedure?
Well, bariatric surgery in general, your BMI usually has to be at least 35. Okay. And insurance companies will require you to have at least one obesity-related illness between 35 and 40. And when your BMI hits 40 or above, you don't have to have anything else going on with you other than being obese.
Gotcha. Okay. And so what about the gastric sleeve?
So the gastric sleeve has kind of usurped the band. So a lot of patients who only got the band because they were scared of the gastric bypass are now our sleeve patients. But the sleeve works a lot more reliably than the bands ever did. And what the sleeve is we are taking 2/3 to 3/4 of your stomach out. You'll never see it again. So it's that outer portion there that you see on that slide. The rest of your GI tract is unchanged. There's no rerouting, moving, changing anything. So how you absorb and digest now is essentially how you would absorb and digest after a sleep. And what I like to tell patients is if you think about it like a tool, you have to understand what the capabilities of the tool are and how to use it. So it's designed to help you with increased satiety or getting full very quickly and decreasing your portion size. But it relies heavily on the kind of calories and the kind of foods you put in because it's just a fancy tube. So if you eat a lot of slider foods like that are high in carb or starch, flour, oily, mushy, fatty, liquid, it'll slip right through and you'll never get that stretching sensation that makes you feel full and keeps you full. So it can be counterproductive if you don't put the right things in and allow the tool to help you.
That's really good. Okay. You got to allow it to help you. Now, what about the Roux-en-Y gastric bypass?
Okay. So the gastric bypass is a little more complicated than the sleeve. But we cut the stomach into two pieces again, but this time it's a 10% piece and a 90% piece. There's nothing taken out of your body with a gastric bypass. So theoretically, it is reversible, but it's challenging to reverse, and we would typically only reverse it for life-threatening situations, such as severe malnutrition, which is very rare, if you kept getting ulcers or other complications. But generally speaking, so once you have that little pouch, that 10% piece, that is now like your new stomach, okay? And if we're straight line naturally, so if you've never had bariatric surgery, from your mouth to your bottom, you're a straight line. Just different parts do different things. So if I do that little pouch first and do nothing else, whatever you eat or drink is going to get stuck in that pouch. So you say, well, how do I get it out of the pouch and continue to be digested? So we take your natural straight line and make it into a Y. Half the Y comes up, gets sewn into that pouch. Now your food and drink can go down that side of the Y. Now the stomach, the 90% that's behind it, isn't moved from exactly where I find it. It still has all its natural blood supply and connection, so it's pink, living, healthy stomach tissue. It still makes acid, so as a function or a purpose, it's just stapled shut so that food cannot drop into it anymore. So on that side of your Y, your acid comes down like normal, your gallbladder and liver make bile like normal, your pancreas is making all of its enzymes like normal, and that's coming down on the other side of your Y. You don't have any absorption of your nutrients and your calories with any significance until the enzymes mix with your food to break it down to molecules that your body can actually use. So it works two ways. You eat less and you absorb less. Versus with the sleeve, you eat less, but from the very beginning, your enzymes and your food are mixing. So that's more time, more chances, more opportunities to be absorbing calories before you get to the ends of your GI tract.
Oh, great. Well, thank you for explaining the differences there.
Uh-huh.
And what about the biliopancreatic diversion with duodenal switch?
So a duodenal switch or biliopancreatic diversion, a lot of big fancy words. It's kind of the most aggressive of all the procedures. I personally don't perform them, but there are some surgeons out there who do. And it's really a combination of a sleeve and a bypass. That's kind of the simplest way I can explain it. So you have your skinny banana or sleeve-shaped stomach, and then the intestines are going to be made into a Y, similar to a bypass. But it's a little bit more aggressive in the bypass piece. So there's typically longer and more weight loss, but it also comes with more malnutrition or risk of being vitamin deficient. So you have to be very conscious and very consistent with taking your supplements so that the rest of your health and nourishment is being taken care of.
Now, are there certain people who normally they would do the duodenal switch on, or is it anybody can do it?
So anyone can do it, but it is traditionally reserved for the super morbidly obese. We're talking BMIs 50 and higher. But you can technically have it if you qualify under the definition of morbid obesity. So it is better for diabetes even than the bypass. And the bypass is very good at improving or resolving diabetes. So if you're a horrible, horrible diabetic, if your BMI is higher than 50, this may be something you really want to consider. But if you have bad reflux, this may not be an option for you because sleeved stomachs tend to increase reflux in a lot of people. So the gastric bypass is the only anti-reflux procedure if that's something that you suffer from.
So let's say, how should somebody know that, when should you know that you should consider bariatric surgery?
I think that you should consider, or at least think about, or at least question if you want more information in a consultation. If you've been suffering with being obese for a long time and you've tried the diet, you've tried the exercise, I hear this every day. Oh, it didn't work. Nothing's working. The weight comes back. I lose 20, I gain 30. It's a constant yo-yo and you don't know where or how to start for long-lasting weight loss. I think it's worth the conversation to see if that's something for you. A lot of people say that bariatric surgery is the easy way out. I cannot disagree with that sentiment more because the battle of obesity is a chronic condition that you can never cure. If you struggle with it, you're probably going to struggle with it even after surgery. The surgery just gives you a better tool to fight the fight with, but it can't make all your worries go away where you can just eat whatever you want and never exercise and think that the weight is going to stay off. It just gives you a better shot of being able to control it. So if you are curious, I say get a consultation. Your bariatric consultant will tell you, are you a candidate? Is this a good fit? What are other options you could try before resorting to this? The consultation doesn't trap you into anything. There's nothing wrong with getting information. You can decide if it's something you want to pursue or not, but I think it's good to have that kind of in your arsenal of options. If you're like, you know what, I want to continue with lifestyle modifications because you haven't burned any bridges by just listening and asking questions.
Yeah, that's a good point. Sometimes it's good just to go and get somebody else's advice and consultation. Now, if somebody wants to go and get bariatric surgery, what is the procedure that they or process that they have to go through before they're approved?
Of course. So most people are going to go through insurance. So you have to make sure that your insurance policy or plan has a bariatric rider or bariatric privileges in your particular policy. Not all employers will opt in for the bariatric rider. So that's one of the first things you have to look into. Then if you do have the bariatric rider, you make your consultation with a practice that takes your insurance. Your insurance is already mapped out at a minimum what they will require you to do for them to say, you know what, we're going to write that check. And on the short end, I always see at least one nutrition visit, a psychological evaluation, and a medical clearance. On the long end, I've seen 6 to 12 nutrition visits, medical clearance, cardiac clearance, pulmonary clearance, sleep study, EGD, upper GI. I mean, the list can get long. And then sometimes on the policies that don't require a lot, I, as the doctor, will add medical clearances that I think you should have, even if your insurance doesn't require it. So once you get, we call the roadmap. Once we kind of show you between what your insurance will require and what your medical needs will be that we need to work up, that'll be what you'll need to satisfy and do before we can submit for approval. If you are approved, then this is a matter of scheduling. If you do not have bariatric privileges, you may need to go the self-pay route, which can be pretty pricey. And that can be anywhere from probably $12,000 to $20,000, depending on if you do it inpatient or outpatient, what state you're in, what hospital you're in. But it's going to be pricey. But at the end of the day, you have to determine what's important to you. So you can try to get an insurance that covers it. But if you really want it and you have the means to do so, you may need to budget for that.
Gotcha. Now, recently in the news, there was a lady who was going to Mexico who was taken captive for surgery. What are the pros and cons of doing that?
So what is it called? Tourism surgery?
Surgical.
I think it was the term is. Yeah. It's very common. It's because oftentimes you can get it much cheaper in Mexico or South America. Now, I will not disparage any physician. I believe that surgeons in South America and Mexico are just as good as American surgeons, but we don't have any kind of like standards that we can hold them to. So you can go there, you can get top-notch care and do great, or you could go there and have an issue, but you could also have an issue in the States. The difference is if you have an issue from your surgery in Mexico and you're back in the States, it's very difficult to find someone who will open their arms and say, yes, I want to deal with the complication that I don't know what they did, how they did it. And if you didn't have coverage to begin with, you're probably going to come out of pocket for any complications regarding that. So I think it's very important to really do your research if you're going to go out of state. See if they have a bariatric colleague in the States that you can follow up with, but have a plan. Don't like, oh, I'm going to have the surgery and then something happens, you're going to end up back at home and you have no idea where to go, who to talk to, and you're going to end up in the ER. Maybe that hospital has a bariatric surgeon, maybe they don't. So you need to think about your whole healing process, not just, oh, this is $10,000 cheaper, I'll do it there, and not be concerned about the aftercare. Bariatric surgery is something that I like to see my patients until one of us leaves this earth. It's not something that, get out of here, because it's constant behavior modification and reinforcement. Even when you're doing well, it's a slippery slope, and it's easy to start regaining the weight a year out, 2 years out, and it's easier to get you back on track. Love the phrase. When you regain 10 pounds versus 50 pounds. So you always want to, get your lab checked at least once a year, maybe talk to the dietitian once or twice a year, but you want that consistent follow-up to try to maintain your success.
Yeah. Well, thank you so very much for coming on and just sharing the knowledge about what is bariatric surgery. Any last minute advice or comments that you have for the audience?
Of course. I will say that you need to be ready. A lot of people are fascinated or curious about bariatric surgery, but it's not a quick fix. It's not a silver bullet. If you do not put the work in to maintain it, it'll all be for nothing. And you put your health at risk, because even though it's 99% safe, nothing is guaranteed. So you don't want to put yourself in a position where you could have a complication. And that's regardless of how good your surgeon is or what your makeup is. It's surgery. Everyday surgeries can have complications. So you want to be a point in your life where you're honest with yourself. You're ready to dedicate the time and make those changes. Okay. So whatever's holding you back from making those changes now, figure out how I'm ready to change, and going forward, this is what I want to do, because it's a forever change. It is a true lifestyle behavior modification the surgery is a tool to help you be consistent, but it can't do it for you. It can't drag you out of the bed. I can't give you 26 hours in your day, so now you find time to exercise. It doesn't work like that. You got to be ready to restructure your life in the same way that someone who's already doing it has figured out how to do.
Well, thank you so much for coming on. And I would love to hear more how someone can work with you.
Awesome. So I do bariatric surgery at Southern Regional Medical Center in Riverdale, Georgia, which is south of Atlanta. My office number is 770-897-SLIM, SLIM, or 7546. If you go to southernregionalmedicalcenter.com, you can find the bariatric practice and to find more information about it. But a phone call is harmless. A consultation is just as harmless, and it never hurts to get information. So I would love to talk to any and all of you.
And can you tell us a little bit more about your Pro-Black Health?
Sure. So Pro-Black Health is a company that my husband and I co-founded about 4 years ago. We're a supplement line. We have about 15 different supplements from multivitamin, organic green, hair, skin, and nail, super cleanses. I mean, there's so many, ashwagandha, elderberry, but the key is the vitamins is really a conversation starter for us. Our mission is to increase health awareness and consciousness in the Black community. Up to 50% of the profits go towards nonprofit initiatives that focus on eradicating healthcare disparities in the Black community. So investment in your individual health is actually an investment in the community. So we're trying to make the community healthier. But yeah, this is, our passion, and we really just want to make a stronger community where health is top of mind and not just all the stuff we see on social media, the bags, the shoes, the stuff that doesn't matter. Your health is your greatest aspect. It's your greatest asset.
Well, thank you again for coming and just sharing your wisdom with us today. Thank you again, everyone, for joining us on the Back on Track Achieving Healthy Weight Loss podcast. If you all like this episode, please share it with others, like it, and subscribe. And don't forget to leave a 5-star review. And we'll see you all back next time.